Mary Morris, a physio at Physio and Health Matters, Ross-on-Wye. I have a special interest in women's health physiotherapy, and I have 3 young children myself, so I do have a passion for looking after mummies. Today I want to talk to you about diastasis rectus abdominis. This is a very common condition which can happen to a lot of women, in fact 70% of women during their pregnancies. So basically, DRAM, or diastasis rectus abdominis, is a separation of the rectus abdominal, the 6-pack muscles, separate, forming a gap. The connective tissue, the linea albia, which runs from your sternum to your pubic bone, becomes thinned, lax, stretched during the pregnancy to allow your baby to grow. It allows, especially in the latter stages of pregnancy, when the baby is doing most of the growing, you will become very stretched just to allow the baby to grow and to have room inside your belly. However, after pregnancy, this should be addressed and should be looked after. Lots of activities, lots of exercise can cause the problem to worsen. When the connective tissue becomes stretched and lax, the abdominal muscles lose some of their ability to perform their job. So the supporting of the abdominal organs, the supporting of the pelvis, looking after your back can all become problematic. So people may say that they feel bloated, and the mummy tummy that people talk about, this constant bulging of the abdominal wall, or feeling like their pelvis is a little bit unstable, lower back pain, lower back ache, or feeling that their back isn't quite as secure or stable as before pregnancy. Sexual function can all be diminished if you do have this weakened abdominal wall. So it is important to be assessed. I can show you later in the following videos on how to assess yourself, but please, if you do think you have a problem, either contact a women's health physiotherapist, your midwife or your GP. There are a few things, simple instructions or simple bits of advice that can prevent this becoming a bigger problem. So it's just such a shame that some women don't find out and do cause these problems or this tummy gap to worsen and then end up with more serious problems or more serious issues. So basically I want you to follow some advice if you do believe or you have been told that you have a tummy gap or a diastasis. We want to avoid all activities in which the abdominals have lots of pressure, so anything where you can see that your tummy is bulging. Things like the plank, sit-ups, press-ups, crunches, getting out of bed in the sit-up action, pushing heavy shopping trolleys around corners, doing lots of hoovering, lifting furniture when hoovering, all activities that need to be avoided if you have the tummy gap. There are simple exercises to get you back to your old self or to get that core strength there again, which are very simple and can be easily tailored to suit your individual needs, your individual lifestyle. Things can be a bit hectic when you have a little one, especially having toddlers. Knowing how to lift your toddler, knowing how to change your baby safely without making the tummy gap worse are all very important. And so if you'd like more advice, please contact us at Physio and Health Matters, or if you'd like an assessment, that can be arranged so that we can organise a structured programme for you to get back to your post-baby self and to get those muscles nice and strong again so that you can go on to safely enjoy either having another baby or to get back to your sporting activities or to just get back to feeling like you did before. Thank you for listening. My name is Mary Morris, Physio and Health Matters, and as I said, if you'd like any further advice, please wait for further videos or contact us via the website or email or even telephoning. Thank you.